And thank you for joining us. With us is Corinne Yost, Liberty Street Surgical Associates. Thanks for joining us.
Thank you for having me.
Well, before we get started, tell us a little bit about yourself.
So like you said, I work with Liberty Street Surgical Associates. I'm the nurse practitioner with that practice, working with the general surgeons. So we have 3 general surgeons under our belt currently, Dr. Weibel, Dr. Paluski, and Dr. Shore. We are about to introduce Dr. De La Vega, who's coming to us to join our practice as well. I get the pleasure of working with them in the hospital, taking care of the hospitalized patients, and then also doing some of the follow-up visits with patients as well.
Very nice. Kind of walk through day to day. What happens with what you do every day?
Day to day, I come in and I check charts on our patients, check and see if we have any new consults or any new admissions, and make sure to see them up in the hospital, make sure everything that they need is taken care of, and then do my rounds, checking in on the floors, seeing if the nurses have the orders that they need in order to take the best care of those patients that they can, and then relaying that information to the surgeons. During the day, the surgeons are in the office seeing new patients or in the OR, so they really rely on me to be able to kind of relay what's going on in the hospital, especially if a patient needs to be taken to surgery sooner rather than later.
How'd you get started in this career?
I got started in this career. I was a bedside nurse at UPMC Hammett in the surgical trauma intensive care unit. I worked there for about 5 years and really just loved surgical patients. I loved the different things that they presented, different ways to take care of them, and just really walking through that process with the patient and their families. And then I went back to school for my nurse practitioner degree and did a couple years as a hospitalist up at UPMC Hammett. But I have always lived in Cochranton, Pennsylvania, and the drive got a little bit tiresome, and this position became available, and it checked all of the boxes that I wanted in my career.
At what age did you know you wanted to get into the field of healthcare?
I would say I was probably about 17. It was right when I started looking for colleges. I have a lot of relatives who are in the medical field, a lot of nurses, a lot of nurse anesthetists in my family, and they really kind of helped point me in that direction.
When you knew that that's the step you wanted to take, was it kind of an easy process to kind of go all in on that, or were you still thinking, I think I want to do this, but let me see what all's out there?
Nope, it was pretty much a all-in process. Okay. Yeah, especially once you get into a nurse program, they really don't give you any wiggle room. You're all in, or you have that first semester or 2 to figure it out if it's not for you. So they really kind of dump you in the deep end.
Did you like the problem-solving aspect, the people aspect, being able to help your neighbors? Did that all come into play?
It did. It all came into play. A lot of it was the problem-solving, and especially with the people, because working in the intensive care unit, your patients don't always get the chance to talk to you. It's the family that you're talking to a lot more often, and you're trying to figure out problems with the patient without them telling you what they're feeling or what's wrong. So it really kind of helped bolster my critical thinking skills and all of those problem-solving ideas that go along with it. So I feel that in my experience, I've become very well-rounded in trying to be able to interact with all aspects of a patient's care.
I would imagine you have to have patience yourself, because you're dealing with, again, families, and it could be a very stressful situation. What all goes into just that part of the job that you have?
A lot of it is empathy. Being able to empathize with a family member, being able to treat a patient like they were your own family member, and how you would want your loved one to be treated, how you would want the provider to be communicating with you if it was your loved one laying in that bed. Definitely just trying to keep that at the forefront of my mind. If this was my mom, if this was my grandma laying in this bed, what would I be wanting the doctors to be telling me, and how would I want them to tell me? And a lot of times that's perceived very well by families, and just really understanding that this is one of the hardest things that they might have to go through, and just talking to them with the understanding that they might not understand it the first, second, or third time you tell them, because they're just trying to digest so much information. And it is about just being patient with them too.
I would imagine, you're checking charts and fluids and all of those things, but kind of walk through just what all is involved, because there's a lot to it.
So in addition to checking the charts, checking the orders, making sure everything is appropriate in that sense, it's a lot of physical assessments, going and talking to the patients and spending some time with the patients, making sure that it's not just a quick one and done type of question answer. It's finding out what's been going on. How long has this process been happening to them? What has changed in their lives or hasn't changed? And now they're in the hospital with something new. So a lot of it is spending that quality time with the patients to make sure that you understand the full disease process before you just kind of jump into, okay, this is nothing, or yes, this is something.
And again, that's where that problem solving comes into play.
Yeah.
And again, sometimes you may be talking to a patient, right? Sometimes you may not be. So
Right.
as you said, it's a lot of trying to fill in the gaps and
Yes, yeah.
just kind of pulling pieces together. And that might be from what you're seeing on the charts versus what you're maybe getting from families, or maybe, if somebody, an ambulance brings the patient into the hospital, you're probably trying to get as much information as possible.
Correct, yeah.
What, obviously it's a delicate situation, especially when working with families, and you mentioned just that personal aspect of trying to treat them as somebody you would know, just so that everybody's kind of level-headed, but not always the case.
Not always the case, no. No, oftentimes because it's such a difficult situation to have someone in the hospital, tempers flare. People say mean things or don't understand and get hot-headed, and that's unfortunately part of the job. You just kind of have to take it as it comes and let it roll off your shoulders and not really take it personally, knowing that if I had met them in a different situation, that may not have been how they'd speak to me. But right now, I might be giving them the worst news that they could imagine, and if they're not happy with that, then that's their prerogative at that time.
What do you suggest to folks? What should they keep in mind when they're dealing with a difficult situation, but coming in and having those conversations with you or somebody you work with? Because you are doing your job.
Right.
Everybody's trying to do their thing. But what are some tips you have for folks when they're maybe in that situation to kind of keep, their cool?
From like a patient and family standpoint, just coming in knowing that we're here to help. We're here to do what's in the best interest of their family member while still respecting their wishes. Oftentimes that's one of the hardest situations to encounter, is taking care of someone who may not have wanted any interventions done and trying to relay that to family when they just want to go full bore and go for broke, essentially. Just try everything to fix them, even though it might not be within the patient's wishes or even a likely outcome. I think that's one of the hardest things to get across to family members, is we could do all of these things, but it may just prolong their misery and ultimately the inevitable. So as family members come in, as even for myself going into any type of family member situation, is just kind of keep an open mind, know that we're here to help. We're here to do what's in the best interest of the patient. We want the patient to get better desperately, but we also don't want to make that patient miserable and cause them further pain if it doesn't mean that they're not going to improve.
How has technology played a role in what you do, and how much of it has changed from the time you started to now, and what do you see happening in the future in this department? Because again, it's an interesting place to be, right? For all these reasons that you have been saying. So just kind of give us a snapshot of how things have changed.
Things have changed certainly in the invasiveness of surgery. Things that used to strictly be open procedures where you're cut kind of from sternum to belt line are now being able to be done with smaller incisions because our tools are smaller, or even laparoscopically with just the cameras. And that's huge because it improves patient recovery time, it improves how well they recover from surgery, and it causes less pain in the long run, and also less problems because you figure you don't have as much scar tissue with a laparoscopic surgery as you would with an open one. So that's one of the biggest changes that I've seen in my short time here, because as things start to improve and we start to get more updated equipment, then we're able to perform those things a little bit more safely with the laparoscopic approach. We have even been able to utilize special dye with our gallbladder patients. We inject it an hour before their surgery and it lights up right where we need to cut.
Oh, wow.
And it causes a lot less concern about getting the wrong area. Things that were more complicated before have become easier because of that. So that's some of the major things, and interventional radiology has certainly played a role as well. Things that they used to rely on general surgery to be able to do now can be done with interventional radiology, where it's an even less invasive procedure. It could just be poking them with a needle, draining out what needs drained out, rather than anesthesia and intubation and a big surgery. So things are certainly becoming less and less invasive, which is better for the patient.
Do you get the reaction of, oh, we can do that here? And I don't have to go somewhere else?
Every once in a while, yeah, we certainly do. And it is kind of comical. We do still have to send some things out to bigger facilities just because it's a little too complex for us here. But what we are able to handle here has grown. We're able to take on more and more difficult cases here because our surgical department has grown. We have acquired new skills and new procedures, and that has certainly helped the community.
So kind of give us that range of patient you'll come into the office. You mentioned just the variety of surgeries. Mm-hmm. From what to what?
So we can have in our office something as simple as a skin lesion that we can do right then and there in the office, to someone coming in who's just been diagnosed with colon cancer and needs to have that cancer removed, and we would be able to take them to the operating room for that. It wouldn't be a, sorry, you need to go to Erie for this procedure type of thing anymore. We can do that right here, and then also follow up the care with them in the hospital and get them over to the Barco Center for continued treatment if they need it.
That's quite a variety.
Yes, yeah, we have quite the span. Coming into the hospital, we see a lot of appendixes that are appendicitis, and also gallbladders, acute cholecystitis coming in, and those are procedures that, for the most part, we can handle them just fine here. And doing it laparoscopically as well. Patients are here for a day or two, and then they're able to go home and pretty much resume life fairly normally, with some restrictions from surgery, obviously, but otherwise they're in and out and feeling a lot better than when they showed up.
It takes a lot to go through surgery.
Yes.
When somebody hears you say, hey, congrats, you made it through. If it's cancer, for example, you can continue care at the Barco Center. You don't have to drive out of town. Going back to that aspect of it, where Meadville Medical Center has the facilities, the people to handle these situations, it has to be rewarding to know that it's been such a great investment in people and in the community.
Absolutely.
To know that we can take care of you here.
Yes, absolutely. And patients are so relieved, because a lot of those patients can be elderly and they might not otherwise have a ride up to Erie or down to Pittsburgh for services. And now that we can offer that here, it's a whole lot easier for them to get medical transportation from home to the Barco Center, or from home back to see us for their post-op visit. And it just takes a huge weight off of their shoulders, because it's a lot easier to ask a friend for a ride down the street than it is to ask them to traverse Pittsburgh. So,
would people be surprised at the surgeries that are performed here? You mentioned just the range, but
I think that we're becoming more and more well known for what we're offering now. So I think the surprise is less often. But we do every once in a while have someone come in and they're like, oh, well, do I have to go to Erie for this? And it's like, no, we can take care of that here. So.
Wow. And that, I'm sure the reaction is very comforting. It's like, okay,
Yeah,
that's great.
yeah. You're like, yeah, I would
Schedule
rather
me.
stay here. Yeah, exactly.
You've seen patients as young as?
As young as about 9 years old, and usually their appendix is usually what brings them in, and then and we can still serve them here. We can still do surgery for them here. We have the appropriate equipment to take care of them. Now, if they're pretty teeny tiny and younger than that, then sometimes they do need to go down to children's just for that specialty care. But we are able to take care of quite the lifespan here.
When you look at the team that's in place, it must feel like you could take on any challenge that comes your way.
Yes, yep. And we work together quite well as a team. I kind of bridge the gap because I'll be with whichever surgeon's on call for that week. So making sure that everything runs smoothly between them as far as switching call and making sure that the patients are well known to each surgeon that's going to be covering for that week. And really just keeping the open communication between all of the surgeons so that everybody knows a little bit about what's going on, and if one of them needs help, the other ones are happy to jump in and lend a hand.
I was going to ask you, how important is the communication aspect? And I'm sure across the board it's extremely important, but just when you have different surgeons coming in or different staffing coming in and out, just to make sure everybody's on the same page.
It's incredibly important. It is, I mean, it could be life or death for a patient. If a vital piece of information is missed, then it could cause horrible outcomes. So making sure that we maintain open communication and relaying all of the facts about a patient is extremely important, and something that I take a lot of pride in being able to do, communicating with my surgeons as well as the other interdisciplinary teams within the hospital, making sure that everybody's on the same page so that the patient receives the best care we can offer.
From the operating room to follow up in maybe the ICU or recovery, again, it's quite a range. Every day's a little different for you.
Yes, it is. Yep.
The website is also a great source to go to if somebody wants to maybe learn more about just the general surgery options that are available here at Meadville Medical Center. People can check that out. It sounds like you could have a stressful day or two once in a while.
Every once in a while, yeah, every once in a while.
Well, what do you do to unwind at the end of the day?
At the end of the day, I go home. I've got 3 beautiful children there that help me unwind in one way or another. So oftentimes it's going to sporting events, or I coach their soccer teams and just enjoying my time out and being healthy. So.
Well, not that far from Cochranton, staying in Northwest Pennsylvania. I'm sure it puts a smile on your face to know that you're helping your friends, neighbors right here at home.
Yes, absolutely.
And what would you say to somebody maybe thinking about a career here at Meadville Medical Center?
I would highly recommend it. I've found myself very happy here. It is a small town feel, and it's not a situation where you aren't close to the people that are making decisions and how it matters, because I can have a conversation with Dr. Kraling, or I can have a conversation with Gabriel Pierce or Philip Pandoff, and it's easy. It's simple to approach them. They make sure that their doors are open and they're available to us, and I think that's huge. It's not just a name on an email telling you what's changing or what to do. They're real people in the building, and they care about the patients too.
Also sounds like if you're a student, maybe you're getting ready to graduate and you're not quite sure what you want to do, but maybe healthcare is something you have an interest in, there's opportunities to get involved, learn, shadow, part-time work, but once you get in, so many doors can start to open, and
Absolutely.
A lot of support for growth. So
Yeah.
that's exciting.
Yeah, it is. So.
Well, we appreciate your time. Thank you for joining us.
Thank you.
And again, you can go to the website and read more about general surgery and all that's offered here at Meadville Medical Center. Corinne, thanks for joining us.
Thank you so much.
And thank you for joining us as well.